if you're sent to a spine surgeon or a neurosurgeon for some sort of corrective procedure, if it involves just removing a ruptured disc, well, that's a non-bony problem. And so that the bone health is just more of a secondary thing you think of, and it's not terribly critical to the success of that kind of surgery. But whenever you're talking about any osseous or bony fusion, which is frequently recommended now for instability or adult deformity or fractures or tumors or slipped vertebrae, that's the real indications for fusion. The bone health is critical. If you have poor bone, the chance of getting a successful fusion will be significantly decreased. So it's very important to ask, I'm worried about my bone, doctor. Can you please check to see if my bone density and bone quality is good enough to do well with the surgery? And that's a simple test called a DEXA scan, or most likely, if they've already had a CAT scan, you'll be able to look on that and actually tell what your bone health is. And if your bit density of the bone and quality of the bone is good enough to get a fusion and have a successful surgery, well, then you don't need to do anything more. But if it's not, you might want to consider being pre-treated with calcium, vitamin D, or one of the drugs we have now, either what we call the bisphosphonates or the teriparatides, preoperatively and then through the surgery, because it has been shown to increase your bone strength. And there's new studies out that show that it will actually increase the chance of getting a successful fusion and hence a successful surgery. And we also believe that with certain surgeries like deformity in adults, that it may hopefully prevent the incidence of failure above and below where your fusion is and fracturing and things along this line. So it's probably really important that you ask the surgeon, is my bone healthy enough to undergo a fusion and have a successful result?